So if you are here today and you are attending this conference, there are two things I want you to remember. The first is that there is a great privilege to be attending this at this point because of the simple fact that these kind of meetings don't happen often. In fact, perhaps once in a blue moon, if I can use that term. And that's because we do not have many Bobby Rameshes in this country. Can you become a Bobby Ramesh? No. There can only be one Bobby Ramesh. But can you become a Bobby Ramesh? Yes. So there's nothing stopping you from becoming someone like another person, because all it requires is will. See, there's a point in time when you sit in one of those rows, you may think that yes, maybe one fine day I'll be standing here and talking. We say that those are dreams and aspirations. We may think it's impossible to achieve what some of these people have achieved. Someone starts a hospital, someone starts a society, someone makes it big. It's all possible with a will. And people say, come on, will alone is not enough. You need to be lucky as well. But luck favors someone with a will. So why I'm saying this? Because it's got an implication to today's presentation. I'll start with some statistics. The population of the United States of America, it's 34 crores. I never knew this, I had to Google. The number of neurologists in the United States of America is around 18,000. And they say there's a shortage of almost 20%. So there can be another 20% added to that 18,000 to cover the shortage. The latest statement by the American Academy of Neurology says that there is a grave threat to the situation in neurology in the United States of America, despite the fact that there are 18,000 neurologists. Let's come to our own country. What's the population? 142 crores, more than 3 times that of the USA. What is the number of, what's the total number of neurologists in the country? 2,500. Okay, just now you just apply the extrapolation and see how much more we need. Now, talking about headache medicine specialists, there are 744 in the United States. And in our country, there's 1 or 2. I happen to be one of them. So this is a situation with regards to headache medicine as a specialty. Now, if I don't show this slide, it won't have much relevance to today's talk. That is my personal journey, which led to a nursing program. So you know that MBBS is around 5.5 years, right? And then normally people have to wait 0 to 2 to 3, 4 years, sometimes even as much as 4 to 5 years to get into a PG program. So apart from my case, it was a wait for 2 years, and after that get into an MD, which is about 3 years. A lot of people will stop somewhere in the way. Some people will end up with MBBS, some will go for MD, and in my case, then again there was a wait for another 3 years before getting into the Doctorate of National Board or DME, and then that's another 3 years. So this is by far the highest training that you can get in India. That's why I draw a line over there. So that 5.5 years plus 2 years plus 3 years plus another 3 and another 3. So all those years are spent in training to get to the level of the maximum possible qualification in this country. And after that, what happens? After that, I have to leave the country to get something more. And that involves taking another 2 years of training from University College London, which is called as the Mecca of Neurology. All the top neurology started from Queen's Square Institute of Neurology. It's another 2 years. And then there was a long wait. If you see, that's a wait for 8 years. And why 8 years? Because if you saw, even in the United States, with 18,000 neurologists, only 744 headache medicine specialists. So it's a huge waiting period to get into a program. But after that, I take that particular fellowship and eventually turn out to be one of the 2 in the country with that particular qualification. So that's about 15 years of training and 13 years of waiting. Now this situation, how it unfolded when I was in the UK. After all this, I go to UK, and in the first week, I have been sent by my boss, my lead, to a nurse. So I asked, what am I going to do there? Oh, you have to learn from her. I said, what am I going to learn from her? You learn headache medicine from her. Okay, I mean, after all this, from long journey from India, going there, and I said, okay, fine. I mean, maybe this is the system here, I'll go there. So this is the nurse that I'm talking about. There's a lady's name mentioned here. Her name is Julie Edwards. 2004, she started as a senior ward sister. Then what happened is, she trained herself in headache disorders. And then it reached a stage where, her performance was compared with 3 other neurologists in how a history is taken in a patient with headache and examinations are done. And then they looked at this agreement level. So there was an excellent agreement between the nurse and the neurologist. And so they started a Band 7 specialist headache service in the UK. And so that's her program. She conducts 6 clinics per week, sees 25 new patients, 40 follow-up patients, and then that's about 30 minutes in the first visit, 15 minutes prior visits, does interventions. So, and what else does she do? She runs a cluster headache service, so that's where I was sent. The cluster headache is a particular type of headache, a very serious type of headache, you know that. So this is only for cluster headache. Referrals from all over UK come over there, run by Sister Julie Edwards. So that's how they are known. If you're a nurse, you're Sister Julie Edwards, that's how we call her. And she advises GPs on the management of follow-up patients, attends GP meetings and teaching sessions, receives referrals directly from the GPs. I have seen her seeing patients who have been referred by neurologists. Not because the neurologists don't know how to treat, but because in that specialized services, there are certain things which can be expedited, which the neurologist is unable to do in his service. That's the person that I'm talking about. The Royal College of Nursing, there is a neuroscience forum. And in the neuroscience forum, you can see this lady, Siobhan Jones, she's a forum chair. And what is her post? She's a headache nurse consultant, and those are her qualifications. So she began her career in 2001. And what about expatriate nurses? You find so many Indian nurses over there. Another person from another country, she was a Filipino nurse, Susie Legrata. Now she holds a very important position. She is actually the advanced nurse practitioner and lead nurse for headache and neuromodulation at the National Hospital at UCL, the institute I spoke to you about a while back. And now she does all the advanced procedure services, including neuromodulation procedures. So she started her career from outside India, and there she is. The British Association for the Study of Headache. They have another subgroup of specialist headache nurses and allied professionals, pharmacists, physiotherapists, osteopaths, physician associates, and psychologists. All of them practice headache medicine. In fact, there is now an international forum for headache nurses, and you can contact them for membership free of charge. There are job applications. Now this came in 2023 for a band 6 headache specialist nurse. So I came back to India, started 2 phases of training. In the phase 1, it was aimed at the nurses, family and community. I'll ask a question. How many among you have Parkinson's disease? Can you raise your hand? Okay, another question. How many had a headache in the last 1 month, even if it is for 1 hour? Okay, that's I think almost like what? 80%? And that's exactly what the study which was published in the Indian Journal of Continuing Nursing Education showed. Headache among nursing staff. Around 85% of nurses had 1 to 4 episodes of headache, and 15% had more than 5 in the preceding month. So just imagine the most productive age group of life being afflicted by headaches. If you take the number of days that probably you were absent or you could not perform, imagine what a great, huge disability that has been for you, your family members, your community, your hospital, wherever, your workplace. So that's the situation, that's the kind of thing. So why I started off with this phase 1 is basically aimed at the nurses, family and community. Phase 2 was at a group level, aimed at patients visiting clinics and hospital. So I'll show you what I did. We started off with a completely online module to promote awareness among the nurses about different types of headaches, and to instruct about the algorithmic approach to the problem of head, neck and facial pains. So remember, when you talk about headache medicine, it's not just this part of the head which is covered. Any pain on the face, ears, eyes, neck, they're all covered. So you should have an approach to those. Because we don't know, we get a pain around here, we go to the eye doctor. We get a pain around here, we go to the ear doctor. So these are all entities which a headache medicine specialist should be able to solve, or a headache nurse specialist should be able to solve. So this was the program overview, aimed at benefiting the self, the organization in which that person is working, in this case Narayana Health, and the community. So we had this training session which went on for 6 months. Every week I used to conduct online sessions, and you can see there were people, that's one group from somewhere in Jammu over there, and then this group is I think in Bangalore itself. So at the end of the program, we distributed the certificates. Those who have attended the sessions, they had an examination. We conducted this and ended this. But I was never happy with this particular level. Then we went on to the postgraduate certificate in headache and facial pains for nurses, in partnership with the World Headache Society, with which I am associated. That was for nurses aiming to enhance their knowledge and skills in headache medicine specialization, providing scientific and clinical knowledge through online lectures and case discussions, delivered on a learning management system platform through live lectures and also offline learning. And the online PG certification exam was conducted by experts of the World Headache Society. The requirements and selection process was a professional degree in BSc Nursing with registration, a nomination link, anyone could self-nominate, and there was a screening test for all the registered nurses to assess how much they already know and how much they have a passion for this. Based on the test, 2 nurses from each unit were selected. Why 2? Because they were sponsored candidates. Each unit could sponsor 2 people, so there had to be a screening process. In the aftermath, the nurses would get hands-on training, practical training in assisting patients with headache who come to different hospital clinic settings. And they'll be assigned to doctors, GPs, neurologists, or doctors who see with headache and patient pains. It could be the critical care, it could be emergency department, pediatrics. And trained nurses will assist the doctors with procedures if required. And there was a practical training plan as well. And what was the result of this? Out of 38 nurses, 22 of them passed the examination. And you can see all of them from across the country. The topper was from Howrah. You can see the various others from Raipur, Mysore, Delhi, Shimoga, Arctics, Calcutta, Jammu, Barasat, Gurgaon, Mumbai. So this is how we concluded the program recently, and they're going to be awarded at a convocation ceremony of the World Headache Society in July. Some of the testimonials, I think she was one of the toppers, is from the Delhi unit, Shimoga, Barasat and Howrah. And so everything is possible. And like our logo of the L&D department goes, building capabilities to drive organizations' growth and performance culture through transformative learning. And at this point, I just want to conclude by saying that this conference, again, one more point, there is innovation and collaboration. Innovation, we always think from the point of view of innovation, starting something on our own, getting a lot of profit out of it. So if you look at the way she has, the way she has blended this, you have people who are from the industry who have built startups and empires. There are people who have started socialist organizations, charity organizations, and so such a great blend. So if you have a willingness, anything is possible. You can be one among hundreds, or you can progress to become another Bobby or another Commander Navneet or another Josephine Madam or anybody. It's quite possible. With that, I conclude and have a lovely rest of the day. Thank you.